Yes. We'll wait until it hits 6 o'clock. Or can we start?
We should start in just a second.
Yeah. Watching my clock. Okay. Are we ready?
Ready.
All right, good evening. It is 6 p.m. and I'd like to call the November 8th meeting of the Board of Health to order. For members of the public that are joining us and have questions or comments, you can raise your hand or type your question in the Q&A, which will be printed and part of the meeting record, I believe. Our first item on the agenda is open forum, and I'll ask that all COVID and mask related comments and questions be held until we come to that part of the agenda. If there's anyone with a non-COVID related item, please feel free to raise your hand, and please remember to state your name and address.
I do not see any hands raised, and I don't see anything listed in the Q&A.
Okay. Then we can, and we don't have the approval of minutes, but that puts us ahead. So we don't have minutes because our minute taker has been out. So when she gets back, we will hopefully get those minutes to approve. I don't know, 6:15 was the variance request. Do we have everyone here for that, or do we need to take something else out of order?
I see that the neighbor is on, Dan Doherty. I don't see that Jeff is on yet. Let's see.
We could discuss the department employee vacancy updates.
Sounds good.
Absolutely. So a couple updates with the employees. Stephanie Dondero is going to be our new administrative assistant. She is ready to go for the 15th this month. She needed an extra week to give her notice. And there were a couple of HR snafus with her. She was waiting for her physical appointment. She needs to have that done before she can start. So she is very excited. She came in on Friday to meet the staff and see the office, and she starts on Monday. So we're very excited to welcome her. Certainly invite her to a meeting to meet you all. And the health director's position is about to start interviews within the next week or two. So we're very excited to see that happening. And I'm just trying to think as far as the consultant that we have brought on, Ira Grossman. He works for the Neshoba Boards of Health. He has been helping us navigate through some of our septic plans under a consulting light item. So he's been wonderful to help us with our septic plan workload. And I think that's pretty much it for the consultants and employee updates. If you have any questions regarding that. No? Okay, great.
Look forward to meeting Stephanie, and glad that will be hopefully helping out the department a little bit.
Yeah, we're excited, very excited. So
can I ask a quick question?
Yes.
Sure. Where did she come from another town? So is it gonna take a lot of onboarding, or is she pretty ready to go?
She actually has quite a bit of experience with Munis, with Microsoft Office, social media platforms. She worked for the Fitchburg Police Department for a little bit over 11 years. She has been in a domestic violence group for the last 2.5 years. And so she comes from municipal background. She comes from very busy offices. We are very excited to have her. She comes with lots of experience in both municipal and private. So she is pretty much ready to onboard as far as she's excited to learn scanning. She already knows Munis. She knows the budget. So we're hoping that that'll be a quick onboarding process. I did get approval through the town manager's office to keep Laurie on for 12 additional hours. Laurie can give 6 per week. So Laurie's going to teach her some of the basics with our permitting system electronics, and it'll be left to the rest of us in the office to onboard her.
That's excellent. I'm glad it's going to be crossover time with Lori.
Yes, me too. Yep, our accounting department has actually requested that they teach her the budgeting and accounting process. And so, you know, Laurie will teach her the permitting system, electronics, things of that nature.
Great.
Yeah, we're excited.
So we're still ahead. I don't know, is everybody here yet for?
I think we have everybody. Let's just double check. Deanna, are you there? I see him there, but I don't see him talking.
Can you hear me now? You can't hear me now?
I can hear you now. Yep.
So we'll
Okay.
go ahead now with the variance request for 20 Burn Avenue with Jeff Hannaford, I think.
Hello,
There's Jeff.
good evening.
Good evening.
Jeff Hannaford representing the applicant, Ruth Blair, for a septic repair at 20 Burn Ave. The reason we're before the board tonight is a variance to the setback to a property line. As you may know, the Title V requirement is 10 feet to a property line, and we're seeking a 4-foot variance to a 6-foot setback. Ray, do you have a PDF of the plan, or would you like me to put one up?
I do have a PDF of the plan. Just give me 1 minute here. Apologize for the scroll. That's a request. And I don't believe I can turn it. Let me just double check here.
Turn my
Okay.
head.
Everybody's head. Ah.
Well, if we all turn sideways.
If you want to.
What?
Yep, I don't have a copy of it, a PDF. Let me double check here. Just give me a minute.
I turned my computer to view it earlier today.
I don't have it.
Okay,
Sorry, Jeff.
that's all right.
I'm gonna send it. Yep.
As you can see on the screen now, even though it is rotated, you can see where Burn Ave is on the left. That's the street side of the lot. The proposed system is towards the street in that front left corner. As you can see, also the house is sitting diagonally across the lot. There is a driveway that I think you can make out between the corner nearest the street and the street itself. It's like a little circular turnaround driveway there. So the reason we're there is because that's where the existing system is. The pipe that comes out to the septic tank now comes right out there at that side. And there are two main reasons. One is the pipe comes out on that side. I looked in the basement, it'd be too problematic to try and reroute the plumbing inside to come out the opposite side of the house. So that's problem number one. Problem number two would be to get to the other side of the house. The topography is lower in that area. And this lot, although this lot does not directly abut Nab Lake, Nab Lake is very close by. As you can see, I do show the 100-foot buffer zone coming through just behind the system and through a portion of the back of the house. So the lake is close enough that the groundwater is influenced by the lake level. So when we surveyed this, we also surveyed the lake level, got the mean high water, and compared that to the elevation of the water table we saw in the test holes, and sure enough, they did match. So with the other side of the lot, it's lower in elevation, which would require us to create a mound, and would end up having to pump that system, and either go through the buffer zone with a pipe to get to the other side around the back of the house, or cut through the driveway across around the front of the house to get to the other side and then create a mound. So it just seemed that for a variance to the property line of 4 feet was justified in requesting. And I also have to point out that the abutter to the left is Dan Doherty. Dan may be here tonight. Dan's not only Dan's not only the abutter, but Dan is actually the buyer of the property. I'm working for the seller currently. So Dan can speak to his opinion on the variance. But I just want you to know, technically, that's why we were here tonight.
Thank you. I guess, Dan, would you like to share your?
Yeah, I think, I think Jeff hit everything, spot on, but the other side, if we brought it to the other side, we're also influencing the lot next door to that, to the right of that, which is on Island Path, which is, there's really no need to do that, as opposed to giving myself a variance of 4 feet, so it just made more sense to put it there, so. And then everybody still loves me. None of the neighbors will be mad.
Does anybody have any other questions or comments? Zach?
Jeff, so in the future, if work needed to be done on this leach field, could it be done without imposing on the neighbor's property, even though it's so close to the line?
Yes. Yep, there'd be no reason to encroach that close to the line to cause any work to be done. We'll be 6 feet from the property line, and the requirement for the installation is to clear anything within 5 feet of the system. So we do have a tiny buffer there, but once it's installed, there's no need to work in that 5-foot area.
Thank you.
And Dan, I just have a question. Is your intent to maintain ownership of both properties at this
Well,
time?
actually, yes. The property here is actually, it's a house for my son. So he is too close, but we're willing to put up with him.
I have a question. Just a quick one, because I can't, it's little, so I can't really see too much of the topography lines. So with in the front like that, is it fairly level then with the, oh, there we go. I did print it, but it's small.
Joanne, it's quite level there.
Yeah, okay. So there's not going to be an issue with fill. I know, huh?
I'm so
Oh,
sorry,
that's-
it's sideways.
No, I actually printed
No
it up,
taken
but
for next
I
time.
didn't blow it up. But so there's no issue with fill or with slope or anything like that. Like you were talking about with having to put the mound, like
No.
going to the next property.
Correct. Yep, this is relatively flat. It does slope gently from front to back, but from side to side, it's flat.
Yeah, okay.
We're not going to be raising the grade above what's existing.
Okay, that's good. So I mean, I was getting into, have to. Okay.
Yeah. Anyone else? I can't see everyone at the same time, so.
I don't see any questions in the Q&A box, and I don't see any hands raised.
And Ray, the department's opinion?
The department is fine with approving the variance. Absolutely.
Okay.
We reviewed the plan. We've gone over it with both parties. You know, due to our regulations, our local regulations, we just wanted to make sure this came in front of the board and that you were all okay with it. You know, especially with a event close to someone's property line that's not 10 feet away, you know, we always make sure that both the neighbor is okay with everything. And in this case, they are.
Right.
I'll make a motion to accept the lot line variance.
Okay, motion made to accept. Is there any further discussion? Nope. Okay.
I'll second.
Michelle seconds the motion. All in favor, and please.
Aye.
Aye. Raise your hand. Or...
Okay, I heard everybody or saw them, so the motion passes unanimously. Thank you. Maybe I can switch my view.
Thank you very much for your time.
Thank
Thank
you.
you.
Thanks, Jeff.
Thank
Thank you,
you.
Dan.
Have a good night.
Yeah.
Okay.
So we're still ahead, and people may want to be joining us for the COVID update. So I don't know if there's something else we can take out of order.
Sure. So we can certainly take the budget out
Okay.
if you'd like to. I did provide a copy of both the budget, proposed budget for 2023, as well as the budget narrative. Those are all the department goals, mission, accomplishments, financials. So I did want to make sure that you all got to see that. I have met with Jody and the finance director on the budget. A couple things I wanted to just bring to your attention. Let me just pull that out. I know the board had requested that the public health nurse go to full-time. I know that's been an ongoing request. According to Jody and the finance director, they can keep Gail, in this case, our public health nurse, to full-time till 2026 with ARPA funding, which is the American Rescue funding, can keep Gail full-time, in which case then we could go before the town meeting to see if there's other funding or financials to keep her on full-time forever. With the ARPA funding, she would have all of the benefits that she has now as a full-time employee. And so I just wanted to make sure you're aware of that and that you were all okay with that. I know I did bring that up to Stephanie. The other positions that you asked about, you wanted to keep the environmental manager position as is with a title change. If that's something that the board would like to pursue, we can certainly do that. That would have to go in front of town meeting. The other item here, you'll notice they've been highlighted. So the reason the nurse is highlighted at 70,000, question to the finance director, is just because they're going to supplement the rest with ARPA funding for right now. Gail is full-time till the end of December with COVID CARES Act funding. And then come January, as long as everything's approved with the selectmen, Gail will stay full-time. And they did have some errors under the health director's salary, as well as the environmental services director. So I asked them if they could check on that. They did make us a mistake. That's why it was highlighted in blue. I don't know if you have it in color on your end.
I'm freaked out. I don't know. Black.
One last thing too that you'll want to know is the substance abuse coordinator. So that was removed in 2022 in our budget. You'll notice that money in our line items no longer exists. So I bring that to your attention. I did mention that to the town manager's office. Our understanding is that that money is being moved to the town and safety task force position of the community health coordinator. My understanding is that that position will reside under the town manager's office, is how it's been explained to me. So I did bring that up to several board members with my concerns, and I am drafting a letter with hopes that the chair will be able to sign off on that. Some concerns I have with our community health coordinator that's going to be hired quite soon through our grant, our services grant, is that that position with the Town and Safety Task Force Community Health Coordinator will both be applying for the same grants. We'll be working on programs together. So I'm just concerned there may be some disconnect in those two positions.
I see a similar face on Joanne to the one that I think was on my face.
Well, and yeah, so I have a tiny little screen, so I'm toggling back
I
and
know.
forth because I didn't print out the 75-page packet.
That's why I'm staring
And
to
I
it.
could turn it, by the way. At one point I did this, but I did figure out how to turn it right. My question is, how does that work? How did, like, if we have a position that's been approved to be in our department, how does it just get removed from our department?
Correct. I asked at our meeting last week, I did not notice it in our budget. And so it was explained to me that the prior person was aware that this was being removed. So I asked, why, and why can it not be? My understanding is it was a town meeting approved position with a salary. And so, as I said, I did speak up to my disapproval. I did speak with our chair, and I mentioned that I think a letter is very important to be sent to both the town manager's office and the select board's office, that we'd
Is it
like
a
to see this
union?
position.
Is it a
I'm
union?
I don't believe that the selectmen have approved the position yet. My understanding is I believe they're voting on it this month. It was explained to me that this position will sit under the town manager's office. They did not feel that the space that's available in our department would be adequate for the position. As I said, we do have our public health shared services coordinator who will be shared between all 4 towns. Actually, interviews start next week for that position. So yeah, someone would have to work remote.
They have to sit somewhere else. That should be fine. That doesn't mean they have to be in a different department, though.
Correct. I agree.
But I don't understand how that's justification for removing a position
It was
from our department because the space, we could argue that for all of you, the space is not big enough. So I guess, is it a union position?
It is not.
I guess I just don't understand how that works. I mean, I know the person that was in that position retired. We were unable to fill it because of budgetary reasons. But we never relinquished the position. We never decided the position wasn't necessary. In fact, we've been doing nothing but fighting to fill that position.
Right.
So I just don't understand
I know
how
that
that
right.
happens.
Yeah, I know that the Town and Safety Task Force has been meeting for quite some time now, and that concerns have come out as far as the schools and the town needing substance abuse, mental health services. I know this is something that's been worked on and talked about, but what happened as far as the money being transferred, again, working on it definitely. I do think a letter is important, that the board's vocal if you'd like to see this position and this money stay in the health department.
I agree with you, Ray. It needs to be in the health department.
Yeah. So,
Yeah, definitely.
I agree too.
Yeah, I agree. Should it be, Stephanie would sign as chair, but it's not, it's the whole board, like we
Correct.
all are in, again, I'm speechless. I don't understand how she just takes a position out of our department.
Would we take our health director out next and put them somewhere else? Like, oh, we're defunding that and now we bring it back in a different place? That's a very odd.
Yeah, I don't understand how that works.
Would the chair find it useful if the board made a motion to that we're depending on what the vote is that we're in favor of, having her come to one of our meetings and explain why she did this and why it has to be taken out of our, I don't even know that she has the authority to do that, to be honest. This is something I feel like we may want to check with town council about, because I've never, all my time on the board, I've never heard of this happening before.
Okay.
Sure. I think that seems reasonable. Would somebody
Okay.
like to?
Good suggestion, Zach.
Yeah.
Yeah, I mean,
and
I'll make a motion that I would like to invite the town manager to an upcoming board meeting to explain why she felt the need to move it, and to explain her authority to move it out of our budget to hers.
Okay.
what's the exact title of this position, Ray?
Substance abuse coordinator, is that?
No, so the position Ray Peachy held was the substance abuse coordinator. He was part-time, 18 hours a week, and the new position will be full-time. The Town and Safety Task Force, the position will work both for town and for school, and it's called the Community Health Coordinator. Now, what's going to get a little confusing is with our grants that we've already advertised, we have a full-time position through the grant, also called Community Health Coordinator, that will be in the health department, shared
So in
with 4 communities.
In essence, she's not really taking that position away. She's creating a new one.
They're creating a new position. They're just using the money from the substance abuse coordinator and they're moving it to this position.
Oh, so they're moving the money from our department to
Yeah,
it.
then it's essentially moving our position. If she
Correct.
wants to go to town meeting or wherever she needs to go to get funding for a new position, that's well within her authority. I just don't know that she
Right.
has the authority to move money out of our budget without our approval.
Right.
And
And I've never heard of that before.
it just also just does not seem to make any sense. It's not logical to house this position. Well, we don't want to lose that, and we also don't want, I mean, it's just not a logical.
I don't understand why that position would come under the town manager anyway. It's a health position. It should come under the health department. So
Right.
it makes absolutely no sense.
So it should, instead of creating a new position under her department, what should have happened is gone our part-time to full-time and left it right where it is. And
Mhm.
the argument of the desk isn't appropriate, is ridiculous.
I think it's about reporting. Am I right, Ray? It's about the person would report to,
The health department.
the person would report to the health department, or no, under what she's saying, wouldn't it report to the town manager?
Correct. Yes.
That's what, yeah, that's what I'm
Right.
saying. That doesn't seem logical. Yeah.
No,
Yeah.
but part of it was, and the space in the health department isn't appropriate. Since when does that become an issue about anything?
Right.
Well, yeah, the reason I brought it up to her was because, as we are onboarding this community health worker for our shared grant, I asked her, would you prefer that we have this full-time person work remotely? We can certainly do that. We're sharing the position with 4 towns. And, the Town and Safety Task Force community health educator could certainly sit in this location here in our department, but that's the reason it came up. So when I asked about the line item at the budget meeting, my understanding is this money will be transferred to that new position.
Okay, so we have motion made by Zach. Is there a second to that?
Point of order, may I ask that Zach, instead of saying it, can
Yeah,
just use the title?
Sure, the community health coordinator. Invite the town manager to an upcoming Board of Health meeting to discuss why the community health coordinator position, both the budget and the position itself, is being moved out of our budget and our authority to another department in town.
Okay. Thank you, Zach. Is there a second?
Second.
That was Joanne, seconds? Okay, all in favor?
Aye.
Aye.
Michelle, are you there?
Yep, she has her hand up.
Has your hand up? Okay.
Yeah.
Great.
I had my hand up. I just was muted.
Yeah, honestly.
Aye.
Thank you. Yeah, that's just a really awkward
Yeah.
on so many different levels.
No, I will certainly reach out to her and see if she can attend the next meeting, certainly. one other item with the budget, we were not cut with anything. We were actually increased in some items that you may have seen. Just a couple, for example, was we originally had a budget line item of $4,000 for conferences for the staff to maintain their CEUs. That was cut last year to $2,000. And so we requested that she bring that back, and she did. So there were several line items too that had to be increased due to Stericycle, for instance, for sharps. So she did approve all those, and we were not cut. So she said it was the first time she's ever remembered. So we're grateful for that.
But I do have a question.
Sure.
So with all of the federal money that we know came into the town, how much more has gone to the health department besides that small amount? I mean, there's 7 million that came into the town, and this is a pandemic. So I don't understand why more money has not come into the health department. I'm confused.
I agree. So it's been an ongoing battle, as you're aware, with contact tracing. We did just advertise today for our new contact tracer for our department full-time, which we're hoping will be paid with ARPA funding. And so as far as contact tracing for the last 2 years, we are using right now, we're going through FEMA for our COVID clinic. We have planning a COVID clinic for 5 to 11 years old right now. And I am working with the fire department and our finance director to have that paid for through FEMA funding.
There was the request for departments and or boards to make a request for funds.
Correct. So I do have that in now for all future clinics, booster clinics, for Gail, anything else that you'd like to see. For instance, I just spoke with the fire department on Friday about approval for FEMA funding due to COVID for the COVID clinic to pay school nurses for our COVID clinic. So that's been approved. But short of that, I don't know that we've received any other funding.
Well, and I would like to bring it up, and I know we've talked about this before, but I think it's probably not a bad place to talk about it here. There's a lot of issues with the school nurses and doing contact tracing in the evenings and on weekends, and there has been no compensation, and it has been a little bit of a bone of contention. The way I look at it is it really should be part of the town federal funds, not the school. I know there's been some pushback, but that it should be part of the school. But actually the school nurses are helping the town. So it is a little bit tricky that, again, 7 million has come into the town. I have seen the spreadsheets, and I am just really disillusioned that there's not more discussion about compensating people that are working extra hours when there is extra funds. And, you know, as a nurse, I think what I find really difficult is police get overtime, firefighters get overtime, and yet for some reason, nurses are expected to do things for free, like flu clinics and things like that. And so it has been a very difficult struggle for me. And I've talked to Ray and Gail about the fact that I am a school nurse, but I am also on the Board of Health. So I feel like I'm in two worlds, and I support absolutely both. But it has been very disheartening with what feels like a lack of compensating people for work done beyond their work day, when most other services you get paid overtime. So I just wish there was a discussion about contact tracing with the school nurses who are doing it on their free time, getting compensated through the federal funding. That's what I wish had happened. But.
Well, so I can't remember anymore. Ray, when were the requests required to be in for use of those funds?
So those are required to be in this week. The board, my understanding is the select board is meeting on the 15th, I believe. I'd have to double check that date to approve the first round of ARPA funding for any emergency use. So we have put in, like I said, for both Gail, because we're concerned, you know, as Sue has mentioned in the past, the contract tracing collaborative closes November 30th. the CARES Act funding ends the end of December, and so ARPA funding needs to kick in, so to speak, for the needs that we have in the department. So those are already putting in. If there's anything that the board would like us to add, we can certainly do that, and I can then pass that along to you, what we've put in the chart request.
Zach?
Is it appropriate to discuss, to Sue's point, having a new line item in our budget? We have a consultant's line item that we've used in the past whenever there's a lot of building going on, or whether, we have staffing issues or whatever, and it's there. Most years we don't really use it or use it much, but it's there, and it's there for a reason, which is sometimes you need to call in help. What if we had a line item that was an emergency nursing line item, or I don't know what we'd call it, but its purpose would basically be for what could be continuing to happen down the road, which would be that we'd have years where we need to have contact tracing, or we need to have clinics, or we need to have any of these services that Sue's talking about that put a strain on the town. Some years, if we didn't need it, it's not like we would spend it. It would be there just in case we needed it. So what, I don't know what the amount would be, obviously, but we could have some discussion to kind of take a stab at it, to come up with a number that we could adjust from time to time. If we weren't using it much, we could lower it. If we would need it more, we could raise it. But just so that it's there for this purpose, because Sue, you have an excellent point, which is when the town needs these services, what do? We just dump them all on the school nurses and tell them, oh, you got to work late, you got to work on weekends. There was an emergency, right? And we lived through that. Now we're beginning to get our head out of it. And I just think we have to start to plan for it.
And
I agree.
can I just say one thing too? Thank you, Zach. But the other thing that I do find a little, I find a struggle is, I'm so grateful for the MRC. I'm part of the MRC, Medical Reserve Corps. But I will tell you that it feels to me like there's no willingness to pay for these services because the MRC will do it for free. So I will give you an example. We had a flu clinic at my school on Wednesday, and it was for the families, children and families. And it was the worst flu clinic I've ever been part of in my life. It was awful. There were only 3 nurses. It was me, Gail, and Kathy Bordeaux. And the line was out the door. We have to do this new computer program, which takes forever. Kids were screaming. And again, the MRC didn't want to do it because they didn't want to do the children. So guess what happened? 2 school nurses volunteered their time, and I didn't get compensated for it. And it feels so to me like MRC, everybody, great, we have retired nurses, which is great, who want to give back. But there are some of us that keep giving back, and it doesn't feel right that in a time of a pandemic, there is not more funding going to the health department when there is so much money that's come into the town. It is a bone of contention for me as both a school nurse and a Board of Health member that at a time of this, that there is not lots of money coming saying, what do you guys need?
Agree.
This is the department that's been putting in the most, well, with the nurses, the most work through the last time frame over this. And all right, so what?
Well, so I mean, if everyone's feeling it, I'll make a motion that we would add a pandemic emergency staffing line item, and I'm open to suggestions on the name, and that we fund it at $200,000 to start, just because I have no idea what it should be funded at, and I'm just taking a stab. But to me, that would be like 2 full-time people for a year if you needed them, and to me that sounds small, because from what Sue is saying, it sounds like we need lots of staffing when these things happen. The good news for the town is I'm not looking to fill these positions. I'm not saying that the Board of Health should have these on staff all the time, but that's there for the director if they're needed.
And so would we be requesting this from the ARPA funds now to use as a filler at, to fill it now? And
Yeah.
then,
Yes.
okay. I think that's a great idea. Any further comment on that? Zach, did you actually make a motion? Joanne, what were you saying?
I'll make a motion, but I'm totally open to friendly amendments and
Okay.
ideas.
So I heard everything. I'm thinking on the name, maybe not say pandemic, only because
Could be an epidemic.
well, or it could be an outbreak, or it could be, you know, if the true nature of this is to have money to compensate or go out and get even a short-term contract in an emergency. The emergency could be anything. Could be, you know, an ice storm like we had when we were out of power for 10 days. We needed a shelter.
Good point. Maybe just
Maybe it's
emergency
just
staffing.
emergency staff, and maybe it isn't just for nurses. What if we need, you know, food inspectors or something? So
Yep.
emergency staffing line item or something like that.
Okay.
And maybe there's a, I don't know, you know, who knows what they'll come back with, you know, it could be, oh, if you need money, come to the finance department. We finance committee, we've heard that before, but you know, that's,
Yeah, I would just argue that the reason we don't want to do that is because in an emergency, you need to move quickly, and the you know, health director needs to be able to, you know, call on those people and say, yes, the funding is there, start tomorrow, you know.
Yeah.
right. And then we'll find you know, more later kind of thing. But you know, I don't know what to suggest on the money side. I don't know if you come in kind of at that kind of a, you know, 200,000 people just laugh and walk away, or they'll be like, yeah, sure, fine. You know, I really don't know.
I mean, with the ARPA funds that are out there and with what we've experienced, I think that's completely within the ballpark.
The problem is if you do it as a line item, you know, at the end of the budgetary cycle, you don't use it, you know, you know, it returns back. So, you know, that may not be a way to fund it. Do you know what I mean? Because
Mhm.
again, that has an end date as well, and they want to use that money. They don't want it sitting there in case it's going to get used. So I don't know. Maybe that's a finance, you know, department question on how the best way to seed that line. I don't know. So, you try to go revolving account, but then you have to go to town meeting.
Right. I was trying to, it also with revolving, you know, you kind of, it's money in, money out. And here, you know, there really is no money in, money out. It's there for when you need it.
Yeah, there's no revenue source.
Right.
True. Yeah. So I guess that's
I will definitely ask.
Okay. Do we need to?
Yeah, I would ask if the board would entertain the motion that we vote on it.
Okay.
can you restate it?
Sure. That the Board of Health requests a line item in our budget for an emergency staffing that we funded at $200,000 with ARPA funding to start.
I will second that.
Point of order. Can we add with ARPA funding if applicable, or if
It is applicable. It is though. I mean,
No,
like when
no.
you.
I'm saying for sustainability though.
Oh, I see.
So, because at the end, so come next.
We won't have the ARPA funding eventually.
Well,
yeah,
it's
it will
it's
go
till
there.
2026 though. Those funds are until 2026.
No, I
Correct.
know that. I know that. But what
Yeah.
I'm saying is if it's a line, like any other budgetary line item, at the end of the budget cycle, what's not used is reverted back and you start again.
Right.
And that may or may not be the best way to start this. I don't know, because they're going to want to use that money. They're not going to want to every year kind of go, are you using it or not using it? Because somebody else could use it. And then we go, no, we're giving it back because we didn't use it. I don't know if I'm explaining.
Right. No, you're right.
So rather than saying line item, do we say emergency staffing fund to be that, you know, that we can then talk to the finance department about how that can remain?
Yeah, yeah, I mean, at least to get it going, maybe saying fund, and if they say, yeah, it should be a line item, that's fine. And I think it should be, because we wanted a permanent thing.
Mhm.
It's just, you know, how do we get the money in there and keep it in
Correct.
there?
Well, and you know what it has felt like to me, and I'm just personally saying what it has felt like, is that the school, and I know there's plenty of needs, right? And it's exciting that this money has come in. And I know there's lots of needs for, utilizing it, but I have just struggled with why there is not more conversations with a health department saying, what do you guys need? What do you need? What do you need? What do you need? We have these funds. What do you need? And it hasn't felt to me like that's happened. I mean, I watched the select board meeting when they were talking about it, and there wasn't a big discussion about, we've got to give back to the health department. And it seems strange to me because this is a pandemic.
And it is strange, even with the FEMA funding. I just found out Friday is available. Well, what do you mean it's available? It doesn't seem like there's enough conversation, that some of these other clinics could have been funded with this money. So, yeah.
And just so the rest of you guys know is that there is a conflict of interest, by the way, about positions. So we have to be careful of, that's what's become an issue about the contact tracing.
Correct.
Okay, so we had a motion from Zach. Will you restate it one more time, Zach?
Sure. The Board of Health has a line item in our budget for emergency staffing for $200,000. I would just say I'm open. I think the board is open to suggestions from the finance director and the town manager and the selectmen on how it should be funded, but I don't think I really care. So I just think that this is important, that it's not only here this year, but probably many years in the future, because when these emergencies happen, you have to be ready. And this pandemic has showed that we have to be ready. So I think keep it simple. Emergency staffing line item, $200,000 funding request. However we figure out how to fund it, that happens down the road.
Okay.
Yeah, so just stop at, at the funding and leave it how it's funded is up in the, to be determined.
Okay.
Is there a second then?
I will second. Yeah.
2 seconds. All right. All in favor?
Aye.
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 Thank you, Zach.
That passes unanimously, but Ray, I think we probably do want to see if we can get, if we have to make that request for ARPA funds, we can start with that at least.
Absolutely. Nope. First thing tomorrow.
Thank you.
Thank you.
Is there any more budget?
There is not, unless you have any questions.
Thank you. You've done a good job jumping in here. All right, so we are on then to our next agenda item, which is COVID updates. Ray, would you like to provide an update on our current numbers or situation?
Sure. So I did put in the packet, which is made public, so anyone can see that. Certainly, I had a couple members ask that they can see the trends of the last 3 weeks with our COVID cases. Today, this afternoon, as of noon, we did have 27 cases in Maven, according to the public health nurse. So it's nice to see that the trend is going down as far as positive cases. The mask mandate is still in effect here in the community. We have had quite a few complaints from folks that are not wearing the masks. We've had both positive and negative letters supporting the mask mandate. As you can see by the packet, we did have a resident who requested that her email and her information be added from Leanne, and I believe that's about 19 pages long, so that was added. We also had a couple board members ask to see a list of the towns that have mask mandates in the state of Massachusetts. That's been added to the packet. Unfortunately, there's no new information about additional communities that have added mask mandates since August. The Department of Public Health and the governor's office is not keeping a list of mask mandates in communities. So I just wanted to make sure that you saw that. That's why they're more news articles, if you will, with the lists. We've had a bunch of new education and information onto our website, all social media platforms. We did apply for a mobile booster clinic here for the community. We were just informed this morning that unfortunately they're not going to be able to provide that for Westford. So we are looking at Plan B. We did put up several locations of where they are offering booster vaccines for any resident that is interested in receiving a booster. Today, we did receive our COVID vaccine for 5 to 11. We're going to be offering 280 inoculation appointments for any child between 5 and 11 who is interested in receiving the first and second vaccine. We have set those dates, and I can bring those up now.
Ray, quick question.
yeah,
The 280, is that 140? So is it for 140 kids or is it 280 for each clinic?
Well, it's 300. We have 300 doses for the
Right.
first clinic and
For the
300 for the
first.
second.
Okay,
Yep,
that's
for the
what- yeah.
first.
Okay.
And then we'll have 300 for the second dose. We're
What's-
putting in 280 appointments. Gail, who is our public health nurse, had asked that we leave a little wiggle room for error or mistakes as far as, sometimes, a child might hit the needle and it hits the floor and you can't use that. So, so for any waste, I should say. So we didn't want to book exactly 300 and not have enough. And as you know, with the new color system software, it only lets you put in so many appointments at a time. So we just wanted to make sure we kept it a little bit under 300.
And when is that going to be opened up? Because I keep having people asking me.
Sure. So because we wanted, before we put out the letter through the school systems, I did speak with the superintendent, Dr. Chu, and told him that I would be providing a letter with the links and all the information, but we wanted to make sure we got the vaccine. And like I said, we just got that today at 11 o'clock that was delivered in dry ice. So first vaccine is November 18th, Thursday, from 4 to 6. And the second one is going to be December 9th, also a Thursday, from 4 to 6. That way kids are able to get there. I believe the elementary schools get out about 3:30 was my understanding. So we wanted to make sure that parents were able to get the kids there to those appointments. We have reached out to the school nurses here. And like I said, we have gotten approval to pay all school nurses that want to provide any vaccine. And we've reached out to MRC volunteers who have already committed as our admins for the software. Those clinics will take place at the Westford Academy. And like I said, first thing tomorrow, we'll be able to get out all those links and information for anyone who would like to sign up.
Thank you, Ray.
Yep.
Great. Did you have anything else?
We do have a question from Matt Edwards. It says there's now the technology with remote meetings to display motions through Zoom. This will help both the board and the community.
Yeah, that's a great idea. We'll have to figure that out.
Okay. Thank you.
Okay, so I wanted to make a few comments related to COVID and some of the emails and calls we've received. First off, again, I'm going to reiterate that I'm thankful for all the residents in our town who have been vaccinated, and I'm super excited that kids who are 5 to 11 are now eligible to be vaccinated. This is really the most important way we can protect ourselves against COVID and hopefully return to a more normal state fairly quickly. And I wanted to emphasize that while the dialogue around COVID has frequently emphasized that children do not generally get as sick from COVID as do adults in the senior population, it's important to recognize that doctors, the CDC, everyone is in agreement that children may not get as sick as adults, but they are still getting very sick from COVID and sicker than they do from many other childhood or things which we vaccinate our children with from. So that we vaccinate our children against many other things, and kids are getting sicker from COVID than they do from many of those other diseases that we already are vaccinating them against. And so I think that's important for people to recognize. And I wanted to point out that unfortunately, Middlesex has returned to high transmission, which is a state at which the CDC says we should all be masking. Westford is also back in the high transmission. The DESE, Department of Elementary and Secondary Education, mask mandate is extended at this point until January 15th, 2022. People have asked what data we look at. I look at the transmission rate data for the county and calculate it for Westford. I follow the data on the mass.gov COVID-19 website. and track Westford and a variety of our abutting and similar towns and look at, in particular, the 14-day average incidence rate, the percent positivity, the case counts for the past 2 weeks, the testing rate. We have information from our nurses in our town on clusters and other potential outbreak concerns. We receive information through the state regarding variants and other concerns related to COVID. There's a lot of information that I think many of the board members are very aware of and staying very on top of, as well as our department. And so I just wanted to explain that, and I need to plug my computer in.
Can I say something too?
Yes, please, Sue.
Okay, so I have tried to avoid making comments when people send articles because there are as many articles that we can find that give us other information. But today we were given an article and asked to have it in our packet, and we were asked to address it. So I am going to address Leanne Kalergis's article, and I thank her for sharing it and giving me the opportunity to comment. I want to say that I need to address several glaring untruths in this article, and I did go through the 19 pages that were given to us. Let's start with the name of the article. The science is clear. Children do not need to be masked. We have countless articles from CDC saying that is just not true, including the fact that we have a decrease in transmission in schools that have mandated it. That was late. That was something from end of September CDC. Then there was a discussion on the lack of transmission from the asymptomatic. And on page 3 of Leanne's article, she mentions that Dr. Maria Van Kerkhove, the head of World Health Organization, reported that it is rare for an asymptomatic person to actually transmit to another individual. Well, there was an article from a few days after saying that that they walked back the comment on the coronavirus spread, saying that there's still too much unknown. So putting that in that article is just not true. Page 3 of the article also talks about early treatments for COVID and mentions ivermectin. The FDA has not authorized or approved ivermectin for use in preventing or treating COVID in humans or animals. Ivermectin is approved for human use to treat infections caused by parasitic worms and head lice and some skin conditions. Any use of animal ivermectin for the prevention and treatment of COVID-19 in humans is dangerous. Again, I did do my homework. I looked up articles that were from reputable sources. And what's interesting, there was also saying hydroxychloroquine, that med that Trump was famous for saying to use, that was revoked for emergency use by the FDA on June 15th, 2020. And what's interesting to me is that people are willing to put these things in their bodies, but not the vaccine. It is just, it's like crazy to me. There was also in that article that a corticosteroid, which reduces the symptoms of COVID, she said in the article that 91% of the time that it worked. Well, that study was of 146 people. So we really have to keep it in context. On page 9 and 10 of her article, she said that the article says Fauci says masks are ineffective. Do a little fact check. That is so untrue. He initially advised people not to wear masks because there weren't enough masks for the hospital staff. And that was early in the pandemic, before there was an awareness that 40 to 45% of people were asymptomatic, nor were they aware that a substantial proportion of people who get infected from people who are without symptoms, which makes it overwhelmingly important for people to wear masks. And please do not talk about masks being dangerous for everyone. My son-in-law is a surgeon. Doctors and nurses have been wearing masks for years in hospitals, and that is for the safety of themselves and for others. I have been on the Board of Health for 10 years, and I have been horrified by the anger and extremism over the past several months. I have volunteered my time all these years because I wanted to give back to my community. As a nurse and a resident, I have no hidden motives. It is not about me, never has been. It has always been about what is best for our community. Threatening me and my fellow board members has been so disappointing. There is an old biblical saying, treat others as you would like to be treated. We should be coming together as a community, but with rallies on the common promoting anti-masking or anti-vaxxing is so counterproductive. I will continue to advocate for what I believe in, and I will look for guidance from the CDC and other reputable sources. Now, with all that said, I am not giving in to the craziness out there, but I have thought about the fact that it is time to maybe take away the mask mandate. Maybe other people won't agree with me, and I will tell you why I'm feeling this way, and it is not because of the threats. If anything, the threats have almost made me want to stand down because it makes me so angry, and I don't want to say no mask mandates. But the reason I have moved toward not having mask mandates is, number one, the numbers have come down. Number two, the vaccine is now available for 5 to 11. Number three, the boosters are available. And number four, we are continuing the mask mandates in the schools till January, which I am incredibly grateful for. So I personally am looking to the rest of the board about maybe lifting the mask mandate, but I need to make this crystal clear that it is in no way giving in to the craziness and the rallies on the common. That is so unkind, unnecessary, and unproductive to all of us.
Thank you, Sue. There are people who are commenting in the chat. The chat is supposed to be turned off. If you have a comment or a question that you would like to make, please raise your hand or put it in the Q&A.
I think we should talk as a board before we open it up to anybody else.
Yes, definitely. So you're bringing up, is it time to remove the mask mandate? My opinion is that maybe the time would be when I'm comfortable with it. As I think about it, we do have the vaccine for kids. They have this opportunity. I'd like to see them have the opportunity to be vaccinated. I'd like to see our numbers come down more. They're still just kind of bouncing around. The boosters are becoming available and some people are able to get them. We are seeing a lot of second or breakthrough cases. I have family members with very serious breakthrough cases right now, unfortunately. They were scheduled for their boosters and unfortunately are quite ill. So I think personally, I think it's a little premature now, but I would like to propose either January 4th, which is when the business mandate goes in place, or January 15th, which I think those dates would give, either one of those dates would give time for kids to actually get the vaccine cycle completed. And then, personal responsibility becomes a big part of it, assuming that we don't have, and hopefully we're still seeing positive on this direction, the no serious variants raising their head or something. Joanne.
Okay, so to jump in here, Sue, I appreciate and I'm so grateful for your words. I think, none of us are on this board with an agenda because of me. This is not about me. It's not about the five of us. It's about the community. And we, have volunteered our time to try to do the best for the community. And like you, so it is eye-opening, I think, as well as disheartening to see the meanness and the negativity and some of the comments and we wouldn't allow this in the schools. It's bullying, it's harassment, and it's sad. But having said that, back to this, I am concerned about coming into the winter months. I'm concerned about the upcoming holidays. And I, for one, would rather us wait. I like the DESI date. It does get us through the holidays. It also, the kids will be coming back. It'll give them, that 7 to 10 days in school, and we can be pretty much sure at that point that people have, the kids are vaccinated, the boosters are out. Not the boosters are available, but technically not for everybody yet. We've only started immunizing the kids, and they have to come back 2 or 3 weeks later. Not everybody can get their child vaccinated on the very first day, so that's going to take, I think they estimated 6 to 8 weeks to get everybody through that system. And we're just so close. These are such great things that are happening right now with the vaccine. I would personally like to hang on a little bit longer. I like the 15th, the January 15th date personally. And then, from there is a point at which, we are going to have to, try to do our best and whatever normal is going to look like, move into that phase. But I'm not ready as we're coming into the holiday season yet. I'm
Michelle?
looking,
Oh, sorry, Joanne.
my idea would be the January 15th date.
Okay, thank you. Michelle?
Yeah, I'd like to echo Joanne's sentiments. Thank you, Sue, for your opinions, and we're certainly very respectful of your thoughts. I personally don't believe vaccines are enough. We're certainly just rolling out vaccinations for our 5 to 11-year-old children. That's going to take a few months to take effect. These children are still bringing virus home to their families and causing clusters. I think we need to maintain our entire toolbox until we are really confident that this virus is under control. We need to use vaccines, we need to use our masks, we need to use our social distancing, washing our hands, increasing indoor ventilation, and working remotely. I read an article today that the UK is now experiencing a big surge because people have become complacent and have relaxed their controls. We have the holidays right around the corner. People are going to be gathering more this year. I see people, colleagues around me traveling internationally. I really think we need to give it some time. We need to get through the holidays. We need to see if we're going to have super spreader events. And I really feel uncomfortable that we would be saying mask this month and no mask next month, and then see numbers increase and masking again. I think that inconsistency in policy is going to cause people to be confused and to just start to ignore the rules altogether. I did see an article that said that HIV killed 700,000 people in the past 40 years, and COVID-19 has killed more than 750,000 in the past 2. So I really feel, as a person who has experienced a serious COVID infection myself, that I want to be as conservative as possible. And while nobody's happy about wearing masks, it's an inconvenience. It is something that is benefiting your community members. So I think for that small inconvenience, we should continue for the time being wearing masks. Ray did send some articles out earlier. Over 315 towns in Massachusetts as of the end of August have a mask mandate. So Westford is not a one-off out there. We're not the nuts. We're not the only ones who are requiring mask mandates. So in my opinion, it should remain in effect at this point.
Okay, thank you, Michelle. Zach, do you have any comments?
Just that there's some comments in the chat asking when we're going to have the open forum part, and I just feel like it might be important to hear from people first.
Okay, do we want to? Okay, so before we hear from people, let me state our. Let's see, what time is it? Okay, so we're going to limit our comments to 20 minutes, with each person taking no longer than 2 minutes for their comment and being limited to one comment tonight. No foul language or negative comments. And we ask people to stick to their point, make their request quickly, and allow the next person to speak. Please remember to state your name and your address for the record. And again, the chat is not being We're not looking at the chat. The chat is not being used.
Okay, so first person attendee we have is Marsha Young. Marsha, are you there?
Yes, I'm here.
Okay, Marsha's the first one.
Can you see me? I don't know if you can see
Marsha,
me.
go
but,
ahead and switch.
Yeah, all right. So Marsha Young at 26 Acton Road in Westford. I'm a retired biochemist and I worked for Pfizer for 20 years. In the pharmaceuticals industry, we always look at risk benefit analysis. And I fear that what we've done is we're so fearful of the risk that we forget that there are two sides to this, and particularly with children. The risk of COVID is far less than the risk of an adverse event with a vaccine. Since we, work for COVID, we don't have, for Pfizer, we don't have all of the information on this vaccine. Though I am vaccinated, I've had my booster. I would recommend all who are really vulnerable to get vaccinated, but it's not important that everybody get vaccinated, and everyone should do their own risk-benefit assessment. If you're a healthy person, you're a young person, you do not need to get vaccinated. If not, you should vaccinate. You should get vaccinated and protect yourself. But you're not at risk from people who are running around. If you're anxious, get yourself vaccinated. Don't force other people to get vaccinated.
Thank you for your comment, Marsha. I'm going to comment. I was a vaccine specialist for the state of Massachusetts for the Department of Public Health. I respectfully disagree. All the experts that I have heard have indicated that the vaccine is safe for children. If you have concerns, though, I would definitely advocate that you speak with your primary care physician for your children, their pediatric physician, and consider and discuss for your particular case whether your risks outweigh the benefits. But the experts are in agreement on this right now that the risks of COVID-19, including long COVID and many other cardiac and other concerns, are significant and are worth considering, and that the vaccine is in the best interest of most children. Thank you. Next. Who's our next person, Ray?
Is Melissa Mackey.
Okay, Melissa.
Melissa, are you there? Melissa? Nope, she just dropped.
Hello,
There you go.
There
can you hear me?
Yeah.
Okay, thank you. So,
Name and address, please.
oh yes, sorry, thank you. Melissa Mackey, 12 Fletcher Road. I'm not here because I find it uncomfortable or inconvenient to wear a mask in Market Basket. I'll wear a mask wherever. I'm here because I have 3 elementary age children. I have a 4th grader who has not had a normal year of school since 1st grade. And I have 2 1st graders who have never had a normal year of school. They are 6 years old, and this is their 3rd year of COVID impact, and that is half their life. So please understand, I feel I have legitimate concerns regarding the impact that all the COVID mitigation has had on their ability to grow in a developmentally appropriate environment. Children have very different needs and vulnerabilities than adults. There is a difference in asking an adult to wear a mask in Market Basket and then having a 3-year-old wear it all day at school. Early childhood is a crucial time when humans develop language and social skills, including the ability to understand emotion from other people's faces. And we cannot continue to pretend, deny, or ignore that mask wearing does not have an impact on these young children. And I understand that maybe it's not all children impacted. However, it especially affects our youngest children, those in preschool and elementary, children with special needs, and even those children who just struggle with a typical school environment. So my goal here is to encourage the conversation to acknowledge that there is in fact a risk of mask wearing to young children, and also to encourage a sense of urgency in developing realistic and achievable off-ramps for these kids. I have concerns that the conversation the board has only centers around cases and preventions. However, 19 months into this pandemic, and we have a generation of children whose needs are not being met. We cannot mask 2-year-olds and pretend it has no impact on them. So I would really like to request that the board, follow state guidance in regards to masking instead of creating our own. The Massachusetts Department of Health has developed a nuanced guidance that takes into consideration the varying needs of a larger group of people. This is why broad mandates are very controversial and should only be utilized in extreme circumstances, because people have different needs, concerns, and values. And when broad mandates without nuances put in place, someone's needs are not going to get met.
Are you wrapping up?
I'm sorry?
Are you wrapping up?
Yeah, I'll wrap up. Okay. COVID's here to stay. Most of you have acknowledged that. We are 19 months into the pandemic. We have vaccines, we have therapeutic treatments. Our hospitals are not overwhelmed and mortality is low. So please, I ask you to have the conversation of realistic off-ramps for the community, realistic goalposts, and an honest conversation regarding the impact that this mask mandate has on our community and our children. Thank you so much.
And I appreciate that. I think I do want to say that while we've listed the clinical or the numbers, I think we're all very concerned about the other pieces that you're bringing up, the social, emotional, developmental.
But nobody speaks to that.
You're right, we haven't, but I know that they are for me. I know for others that they are also of concern. Thank you. Okay, who's next in the queue?
We have Kathy Lynch.
Kathy?
Hello. Okay, you hear me?
Yes.
Good, thank you. Kathy Lynch on Rush Road. It's been 3 months since I last addressed the board asking you to reject the medical mandates. Many in this town are upset about masks on their children and the fact that you went as low as 2 years old when even DESE only recommends 5 years old and up. $300 fines, masks on children and adults participating in strenuous activities when this is exactly when they need to breathe and more oxygen goes way above and beyond being reasonable. There are other Massachusetts towns rejecting mask mandates fully or partially, including towns near us: Acton, Pepperell, Tingsboro, Carlisle, Concord, Chelmsford, and many more. Schools can opt out of mandating masks, but they're demanding these be on our precious children who need to see faces for social emotional development. Intelligent adults are capable of making their own health decisions for themselves and their children. The same holds true with rushed experimental COVID injections. Hundreds in this town have petitioned the board and stood out on Westford Common to protest authoritarian mandates. Fear-mongering about cases that mostly have little or no accompanying symptoms has led to absurd behaviors within the public. We have seen people wearing masks outside alone in fresh air or driving alone in their cars. Just the other day, I was in a restaurant where people were supposed to wear masks while they were walking around the place, but at the table, they didn't have to wear a mask. Do you think the germs stay in one place and don't circulate within the air? Of course not. And why is it that I have to wear a mask to protect you? Doesn't your mask protect you? Look, if you think the masks work, wear them, but don't demand it from those who aren't buying this fear campaign. We're not asking you not to wear a mask, yet you think you get to tell us to wear one. And we're not asking you not to get a vaccine, yet you think you can tell us to get one. You have stated very clearly in board meetings that you think the ultimate safety measure is getting a vaccine for protection. First of all, you can get and spread COVID even after being injected with the shot. In fact, scientists are saying these variants are being spread.
I think she needs to be cut off. I think the time has gone on too long, Stephanie.
Yeah, I was going to say.
Thank you.
Can I close with one sentence, please?
Yes, you may.
I'm assuming that you are trying to help the public, but there are many of us who do not need or want your help when it comes to intrusive mandates. You can recommend or advise, but don't mandate. That's tyrannical.
Thank you, Kathy.
Can I address, I really have to address this because Kathy, you're one of the people that has been harassing us and telling people to, call our houses and things like that. And yet I've seen you at church. It's like the craziest thing for me. But I have to say there are still mandates. You're mandated to stop at a red light. You're actually mandated to wear a seatbelt. You're mandated to wear helmets when, a helmet for a bike, and there's lots of mandates out there. So this stuff about we shouldn't tell people what they have to do, and that we should do, I should get a vaccine because I want it. I should get a mask. I should wear a mask because I think it's good for me. No, it's about protecting others. Getting vaccinated is protecting others. Wearing a mask is not just protecting me, it's protecting others. And yes, there have been breakthrough, but in every case of breakthrough, it has started with the unvaccinated. So I don't care what people are saying. We're not mandating in Westford that you have to be vaccinated. We have never made that mandate. But to stand on a town common and to encourage people to scream and yell at us and come down on us is so incredibly unchristian, unkind, and unbelievably sad.
Okay, and I also wanted to add that the CDC or the DESE actually recommends 2+ masks. They don't require it, but they recommend it. And that I have been very carefully tracking what the other towns are doing, and that I'm glad that we are not Tingsboro or Chelmsford, who have much higher rates of infection than we do, that Littleton has a mask mandate because they have been having a significant problem, that Carlisle and Acton have a very, very low rate of cases, and that's why they haven't needed to put in a mask mandate. I would happily remove our mask mandate if our
Can I make one comment to Stephanie? If and just going forward, we do not mandate in schools. DESE has put that requirement in as a mandate in the schools. And, almost speaking to Sue's comments, we are being accused of things that we do not have control over or that we are not doing. So, everybody has freedom of speech, but just make sure that if you have something that you want to direct to the board, it is something that we have control over.
Although, Joanne, our current
DESE stuff is not us.
But our current mandate supersedes the DESE mandate right now in the schools.
But the DESE exists.
Right. And it's
happening there. Whether in these communities that don't have mask mandates, the kids are masked in school.
Yeah. Right. Thank you. Okay. Next
is Alexander Gonzalez. Go ahead, Alexander.
Alexandra Gonzalez, 2 Elm Street.
I apologize.
That's okay, no problem. I would really like to see, the school nurse just said every case where there's been an outbreak is due to an unvaccinated individual. I'd love to see the data on that. Continuing with what I wanted to say though, this summer the media scared us moms big time, telling us that a Delta variant was deadly to our children. On October 18th, Reuters published an article titled "Delta does not appear to make children sicker. Secondary response stronger than infection after the shot." Secondary response stronger after infection than after the shot. That article describes a UK study where researchers compared 2 groups. Okay, it's a control study. They had 694 infected with the Alpha COVID variant and 706 infected with the Delta. In both groups, half of the children were sick for no more than 5 days. The researchers concluded that Delta was broadly similar to COVID. The damage, though, was done to moms' psyches. I know because I'm a mother too. It's this fear mongering mostly by the media, but also by government officials that bothers me the most. I understand that you members of the Board of Health are afraid and feel responsible, but you need to look at both sides of the issue. There's a lot of group think going on here. I don't mean to offend, but I do have a right to voice my different way of thinking, and I feel just as harassed as you might feel. Question for public record. Will a novel non-FDA approved vaccine reduce hospitalizations in kids 5 to 18? Well, according to the FDA, it will do the opposite. An article on MedPage today on October 25th documents an FDA benefit risk assessment in which the FDA predicts more excess hospitalizations due to vaccine-related myocarditis and pericarditis compared to hospitalizations that would have occurred due to COVID-19. So I think that's something worth asking. Question for public record, what are the long-term side effects of mRNA technology and vaccinations? Do we know? Then why, if we don't know, why the carrot and stick approach for getting young people vaccinated? Kids feel pressured to capitulate, and vaccination doesn't rule out outbreaks in school. And I can't believe that every single outbreak is caused by an unvaccinated. I'm sorry, but that is not something I will believe. Who does this matter to most and why? It matters to our children. They are learning to be deathly afraid of something that won't kill them. With anxiety and depression on the rise in kids, we are showing them to cower in illogical fear, to hide our faces before adversity. We're not making sturdy children who will bravely rise to meet life's challenges. Life is not safe. Life is not full of assurances. Our children need to know how to assess real risk and how to meet the challenge, overcome, and adapt. And I don't believe it's the government's job to make the world a better place. I believe it's our children's job to do that. Thank you very much.
Thank you. Next, unless there's comments.
Yep, there are a few more. Hugh McDonald.
Can I make a quick comment?
Yeah, Joanne.
I'm hoping that our children learn to be giving and respectful of others and part of the world population so that they will use vaccines or masks or any other way to protect others, that they learn from this pandemic that we are all in this together and that it's not all about me, it's about us. That's what we should be teaching our children, that yes, the masks are uncomfortable, but we do that to be helpful and respectful and to take care of others. And if that's what you teach them, that it's uncomfortable and it's scary and it's, you know, whatever, that's what they will learn. But if you teach them to be, why do we have, you know, to volunteer and take care of others and go to soup kitchens and all, you know, do everything else that we want them to grow up to be sensitive human beings, that would be a very good outcome of this.
Thank you. All right, Hugh.
Hi, Hugh McDonald, 14 Jefferson Road. I've got children in WA, Blanchard, and Crisafulli. Last week, I was watching my son play rec basketball at the Abbott School. And he's a 13-year-old kid, and they're running up and down the court, and they're sprinting, and they're gassing. And, you know, I'm watching, and I hear my son being called out, pull up your mask. You got to pull up your mask. And I'm thinking, this is crazy. The kid's sprinting. He's gasping for air. You know, he's trying to catch his breath and get some oxygen into himself. And he's being told to cover his nose and his mouth. I mean, to me, it's cruel and it's unsafe. And, you know, I don't know what it's going to take for some folks to realize the danger of that. If it's going to take a kid passing out to fall down and knock his head open, or what? So I'd just like to hear the board's response to that. Thank you.
Thank you. Right. That was, I think, you said there, yeah. I don't know that I have a great response for that. I've watched college athletes play with masks. I acknowledge it's a difficult situation, and I hope it's not going to be a part of our situation for long. That would be my response.
Okay, next person we have is Olga Fradkin.
Hello.
Hi, Olga, please state your name and your address for the record.
Olga Fradkin, 34 Caldwell Drive. So first of all, I wanted to thank you. I mean, it seems like all of you have a good intentions. I would like to make a few comments to previous one. First of all, I didn't know that expressing the opposed opinion is considered violence or unchristian. That was a surprise to me. I thought we all have our opportunity to express our, you know, and sometimes, yeah, it's maybe opposed opinion, but we all have a right to express our opinions. And second of all, you know, when the society sacrifices its kids, it's actually a sick society. normal society protects kids and doesn't sacrifices. And actually sacrificing kids' childhood, I don't think it's actually a sign of a healthy society. Now, I did want to make a point, that I was very surprised that you guys completely ignore natural immunity, like it's non-existent. It doesn't matter that humankind have survived thousands of years and mostly rely on our natural immunity. Not a word. I want to mention just a few recent studies
Okay, I'm gonna
about the
let-
natural
we have
immunity.
30 seconds left.
Absolutely. So an Israeli study of 2.5 million people found that vaccinated group has a 7 times more likely to get infected with COVID than those with natural immunity from a previous infection. Another Israeli study that included 700,000 people found those with prior SARS-CoV-2 infection were 27 times less likely to develop symptomatic infection for the second time compared to those who are vaccinated. And I can go on. And just from my previous, my kid is in Westford Academy. He didn't have any symptoms. I tested him for antibodies. He had them through the roof. I believe a lot of kids already have immunity, but we continue to pushing the vaccines. And just another, you all mentioning DESI. Just, the commissioner, I just want to wrap up 10 seconds. Massachusetts Association of School Committees had 3-day maskless convention with the DESI commissioner, Jeff Riley, but he's forcing children to wear masks. So it's just hypocrisy. It's really hard, guys, to actually take it seriously when, it's just hypocrisy everywhere. Thank you.
Can I just make one comment?
Sure,
Having
Sue.
a difference of opinion is absolutely, we have a right to, just like we're talking among ourselves and some of us have a different opinion. It's how you do it. So I have no problem with people's opinions. I have a problem with how they have come about with having rallies on a common and anger and hatred. That has been the problem. That has been my issue.
I think, everybody has a right to free speech, and the rally is a rally is fine. But there has been an attitude that I think many of us have felt, and that's been disappointing. Next,
we have Leanne Collages.
and we are about at our last. How many more people do we have in the queue? Because we're pretty much at our limit time-wise.
Marsha Young has raised her hand again. I didn't know if you're listening to people twice.
One time only.
Okay. So Leanne, are you there?
I am. Can you hear me? Thank you. I did have some other things to say, but some of the things have been covered. I'm sorry?
Name and address.
Oh, I'm sorry. Leanne Collages, 2 Lawson Road. I did have some other things to say, but a lot of things have been covered. I did want to clear up one thing. Animal ivermectin is not what's being prescribed to humans. I do know that there was some misunderstanding about people taking the animal version. That's not what's saving lives. So I just wanted to clear that up. And hydroxychloroquine is also being used to save lives. So I just kind of wanted to clear that up. And actually ivermectin is on the WHO's list of essential medicines. So it is an approved medicine for lots of uses, and doctors are saving people's lives every day with it. So I just kind of wanted to clear that up. It's not March of 2020 anymore, and masks didn't stop transmission then, and they never will. I'm making a formal request for you to show us any randomized controlled trials that prove masks stop transmission. Do you plan on having any kind of community empowerment and give them information on how to boost their immune systems to stay healthy, and the effectiveness of early treatments to dismantle the fear campaign and division? If you're not willing to acknowledge the mounting evidence, please step aside. Our community needs a health board who maintains an open, inquisitive mindset. I do recognize, I know we're all really going for the same goal. We want a healthy community. We want our children to be healthy. We may be looking at it from different angles, but I do believe that with open honest debate and conversation, we can come together in an agreement on what's best for everyone. The information handed down through captured media from regulatory agencies is corrupt. They're funded with millions of dollars from the very pharmaceutical companies they're supposed to regulate, and they're no longer worthy of our trust. Are you willing to look at research studies from reputable sources free from any conflicts of interest? That's really important. A divided community will never be a healthy one. But with this information, you can promote health and unity by letting individuals choose for themselves and by rescinding the town-wide mask mandate immediately. It's really very simple. When we know better, we do better, and we can do it together.
Thank you. I just wanted to say one thing. While ivermectin is an approved medicine, it is not approved for treating COVID. And I have actually experienced an ivermectin overdose when I was being treated for parasites after volunteering in Haiti after the earthquake. It was an extremely unpleasant experience. So I really, really, really would encourage people to be very careful.
And neither of those meds are FDA approved for COVID, by the way. Yeah.
And I have read many studies about it and have not seen. I would love it if ivermectin or hydroxychloroquine, because I've had both of them in my life and they're easy and readily available. And if they really worked, it would be phenomenal. But there have not been any studies to date that I have been able to find that support them as a positive treatment against COVID. That being said, I looked at the Q&A. We've reached the end of our time. I looked through the Q&A. I think most of the questions have been addressed. There was one about where are we in relation to the parameters we set. I did address that. We are actually not as good currently as we were at our last meeting in terms of our risk factor. We are in the high risk category again, instead of just the substantial. And so I think that's that for the questions and comments. So back to, somebody had asked about, I'm sorry, there was another one in there. Would we consider changing the mask mandate for the 2 to 4 year olds? Oops, sorry, hand that on to.
We did have a discussion about that, I believe, in the last.
We did at our last meeting.
I don't think we changed it, but.
Didn't.
The only thing you changed at the last meeting was with regard to nap time. You guys with me take a nap.
So I guess, so you brought up, do we feel, okay, so people are still commenting in the chat. The chat is supposed to be turned off. I would appreciate it if you would stop. It's not supposed to be on. Yeah, so you had brought up whether we would be interested in removing the mask mandate at this point.
Well, and again, believe me, it is not because it's because there's a couple things too. I feel like this has been a very difficult thing on the health department to even enforce. I think people that are against the masking are kind of putting their fingers up at us anyway and going into stores and not wearing their masks. I personally will continue to wear a mask everywhere I go because I don't trust people. I've gotten the booster, I am fully vaccinated, but unfortunately we still have had breakthrough cases. And as you said, Stephanie, I've had friends and family members who have gotten really sick after being vaccinated. This virus is still a dangerous virus. So I suggested lifting the mask mandate. Doesn't mean I'm going to stop wearing my mask. I still wish we would highly recommend it. I just feel as though, first of all, I don't think we can say we won't talk about this again until January, because that's really not fair. We said we would talk about it at every meeting. And I think we owe people the right to do that. Everybody's entitled to their opinion. I have just been thinking a lot about this. And for me personally, I will continue to wear a mask. But I think the sustainability with people, even people are so threatening right now too, that they're going into stores purposely with their masks off. And I think almost, trying to get a discussion going. And it just feels, I feel like our communities become unsafe, which is so sad. I totally agree, Michelle, Joanne, Stephanie, everything you said. I am all about keeping people as safe as possible. And yet there are things that I do take into consideration. I know how hard it is to work out when you're wearing a mask. That's not something, so I appreciate what the gentleman said about basketball. I get it. I do worry about the gyms, and I do worry about small businesses being affected by the mandate. So there are certain things, and yes, the booster, you're right, not everybody has had it, but more people have. As somebody who's done contact tracing, the numbers have definitely come down. So I've seen it in the Maven workflow. We have not had as many cases of COVID. And I'm thrilled that the school system is continuing to have the mask mandate. I totally approve of it in the school setting. But in public, I have just, like I said, I will continue to wear the mask, but people have approached me gently and talked to me about things. And those are the ones I'm listening to more than the angry voices. And so, again, I'm just one voice. There's 5 of us. So whatever everybody wants to do. But if we decide to keep the mask mandate, we do need to address it again next month. We cannot wait till January. I don't think that's fair.
Zach?
Sue, I really agree with pretty much everything you said, so I don't want to rehash it. I'm in agreement with Sue. I feel that I've been to businesses and restaurants where basically, I guess, everyone there has decided they're not going to do the masking in this town. And so it does put a real big burden on our department, which is not really equipped for this, let's be honest. Our department cannot go and enforce this mask mandate. And so it puts the Board of Health in a really difficult situation where we're supposed to enforce something that really is impossible to enforce with the staff that we have. So I kind of agree with Sue that asking the community that we highly recommend it, at least then puts the burden on people to listen to that if they believe it. Whereas if you go into a place where people aren't doing it now, and then it gets into negative back and forth and heated discussion and people yelling at each other, that's not what we're aiming for here. I mean, that's going back to some of the comments we heard from people. To keep people healthy, stress is one of the things we want to reduce, and it's very stressful. This is a very stressful time. So while I agree with Sue, and I am going to be wearing a mask everywhere I go, I am feeling that maybe it's time for us to consider this being just a highly recommended action, and leave it up to community members to make that decision themselves.
Can I just add one other quick thing too? It is businesses who, in my opinion, businesses who choose to want to continue to mandate it can. Everybody has the right to do that. And again, if we did change, I would want every business to have it in the window that the health department strongly recommends. So again, I'm just sharing my viewpoint, and I support whatever decision is made.
Is that something we can do? Can we ask or require businesses to post that the Board of Health strongly recommends masks be worn?
We have them post that they have to wear masks at the moment.
Right. So we can tell them that they have to post that they strongly recommend it.
Why bother? So I'm going to just chime in now. I'm not there yet. I hear what you're saying, but I am not there yet. And I'm not going to change my opinion because of it's too hard to enforce, or it's too hard to do, or people aren't doing it anyway. I get that, but I don't see that as a reason to stop doing what we had felt was the right thing to do. And again, I am very concerned about the upcoming holidays, the gatherings, and being indoors. I personally would like to see us get through this last hurdle, these last 6 to 8 weeks, and then at that point, I'm sure we'll be in a better place, and I'd be much more comfortable. So.
Joanne, to your point, though, a question. I agree. The holidays typically, when you look at the data, last November is when we saw the spike, and a lot of that is attributed to people traveling, people meeting closely. But with our mandate, I don't know that it actually addresses that. I mean, because we're talking about wearing this in, stores and restaurants and so forth. People are going to travel, they're going to be meeting with families, and our mandate isn't going to affect them in those cases.
That's true.
That's true, but again, and that was part of the thing. We don't live in a bubble. We have people that come into this community, that will come into the businesses, that will come into, the school settings and things like that after traveling and bring it back with them.
Yeah, I agree with
do we
Joanne.
do we
I'm
not
not ready.
do we not protect the people that work here as well? Do we not protect, is it, it's everybody.
Yeah, I agree with Joanne. I think it's premature. I think we need to leave the mask mandate in place and reevaluate on a month-to-month basis.
I'd like to see the January 15th, date put in there, so that we have a date. If we wanted to change something, I'd be willing to talk about the little ones. But I don't know. I'm not ready.
Okay, so can we bring up the little ones then? Yeah, the 2 to 4 year olds. Are we willing at this point to maybe change our mandate? Oh, Ray, you have your hand up?
Okay, take it out in 5 minutes. And
No, I just, from our department perspective, I certainly agree with, Joanne's concerns about the holidays and the numbers and the cases. I see where, Sue and Zach are coming from. I will just say from a department perspective, it is very difficult right now to enforce the mandate. We are calling everyone. Today is actually the first day right before the meeting where we were able to make an actual visit into a place where we've received numerous complaints regarding. And today was the first time that I issued a $300 ticket to an establishment here in Westford since the beginning of COVID, which I'm happy to do as far as, enforcement and, it's our job, but it's very difficult. I will just say from what we're hearing, businesses are struggling to get staff. And so for the staff they have, they're being harassed. From what we're gathering from a lot of businesses, it can get violent. People are getting upset at other people. They don't want to wear masks. They're asking about medical exemptions. Is there a form for medical exemption? So I just wanted to mention that from a department perspective that, we will continue to do everything asked and certainly do the best we can. But with our vacant positions at this point, we're calling people.
It's very disappointing because from a public health perspective, I feel very strongly that the mask should still be there and that it needs to be, that from a public health perspective, the appropriate thing is to continue the mask mandate. From a public safety perspective, it seems like we're almost experiencing something different. Although I haven't personally seen that. Zach?
I mean, this is a very nuanced point, but Ray brings up a really important point, which is that when people are mandated to do something and it keeps going on longer and longer, more and more people begin to just want to push back against that mandate because we're Americans and we feel like we have the right to do things. I agree with Sue. We have the right to do things, but we also have plenty of things mandated on us. I'm in the construction industry, and there's so many things you probably don't know about that you're mandated to do that are in your house right now. So if you're talking about complete freedom, we do not have complete freedom. But getting back to the point of this nuance approach, if you say from the Board of Health that we highly recommend something, I think that gives an empowerment to people who want to wear masks to say, this is what the community is recommending, and I want to do it, and I'm doing it. So if I want to go into a store or restaurant and wear my mask, I can feel good about doing that. When it's mandated and it's going on month after month, and we don't have a strong surge number going up, I feel like a lot of people push back just because they want to push back. And that's what I'm afraid about, is that week after week after week, that's going to get worse. And as we're hearing from Ray, there's that violent tendency that people have. And so, while I completely agree with you, Stephanie, from a public health point of view, it should just be clear, it should be obvious that vaccinations and masks help. If we really do want to help everybody, we may want to consider making this highly recommended rather than a mandate.
So I'm looking at the numbers, and this is just where I struggle, because we went from so this is the case count over the 2 weeks. And in September, which was on the late side after we'd made our mandate, we were at 83. We got down to 45 at the end of September. We're back up to 68.
I don't think that's our number right now. Ray, what did you say?
These are the reported numbers from the state.
Okay.
This is the 2 week.
Okay, because currently in Maven, there's
Right. This is
Correct,
the
27.
27 cases.
as of the 28th. So it pretty much tracks to, if you divide it by 2, it gives you close to your weekly number. We're very far from what we'd set as our goals. We're nowhere near the old green. We're not in substantial, we're in high risk still. And the kids haven't had a chance yet to get their vaccines. So I think I am not in favor yet of removing it and just saying recommended. I want to give those 5 to 11-year-olds time to be vaccinated. There's so much that people have said. There's so much more I could say about the disease, about vaccination, but we don't have time. But I am concerned about the 2 to 4-year-olds and the challenges there, and whether, I don't know, have we been having outbreaks lately in that population?
No.
Ray?
No.
Sorry, I'm on mute. No, we have not.
So, I mean, I guess I would make a proposal that it was the original language that allowed for.
I think it said everyone ages 2 or higher had to be masked.
Right.
And
Correct.
So we could
Correct.
strongly recommend 2 to 4-year-olds and require it for 5 and up.
Well, it's required in the schools. So in the
Right.
schools, it's required, and in the younger age, it's recommended. So like in the preschool, it's not mandated. If they're under 5, it's
And I
recommended.
think it's possible for them to wear it. I know plenty of children who do and have, but I do appreciate that there are some, I mean, it would be a challenge. And if we haven't had outbreaks recently in that crowd, I would be willing to amend that.
To recommended?
To change it that 2 to 4-year-old are recommended to wear masks and 5 and up are required.
Right. I'm okay with that. I'm not okay with changing something because of bad behavior of the public. Because they're the one, because an adult cannot act like an adult and is harassing or mean or yelling or pushing back like a 2-year-old. That's no reason to change, a mandate. At this point, I don't, Zach, I hear what you're saying. I just don't.
No, but it's not. No, it's a more nuanced point than that. It's not that I'm giving in to bullies. I'm saying that this is highly recommended will tell people who are listening that we recommend it and that you should do it. And it'll make them feel empowered to do it. If they feel like we're
mandating
telling them
it.
to do it with, mandating them to do it, then it's the same number of people who weren't going to do it aren't going to do it. Let's be honest. I mean, there's a percentage of people who feel for whatever reason that they shouldn't get vaccinated or they shouldn't wear masks, and they're not going to do it. Nothing we mandate that I can think of is going to change that, because I've seen it in action. I've gone into restaurants where no one is wearing a mask at all, and then 2 restaurants down in Westford, everyone's wearing a mask. So something's going on there. And I'm just saying, if we had the staff and the ability to go in and fine and everything, but Ray just told you it took her weeks with her staff to get into one place to do that. So we just don't have the staffing to do that. And I'm saying, I think we're actually fighting ourselves the longer we do this. I'm not disagreeing with everyone here that we should be wearing them. I totally should. We should. I wear them. It's the approach, and I just think we're seeing what happens when this keeps going. People are upset. Look, we heard from Melissa tonight. She's upset. It's been 3 years of this affecting her children. That anger starts to come out at somebody, and that anger's coming out right now at us because we mandated it.
Well, yes, but we didn't invent the pandemic. To getting mad at us is counterproductive. This is the world today.
It is counterproductive, but that if you take away the mandate, they won't have that to pick on anymore.
Littleton lifted their mandate. So one thing you guys should know too is we're seeing the numbers, and like Ray, what you shared, which is true, that was in August. Now some of the towns have lifted the mandate. So
Littleton's numbers have
the only one I know is
What's
Littleton.
that?
I guess I wonder how many people, because we keep hearing from the same 6 or 7. We're a town of what? How many? 24,000, 25,000, whatever. I know that there's people who are perfectly happy and thrilled and appreciative that they feel protected in this town and in other towns as well, because I've heard it obviously in the one I work in. So, again, I think there's plenty of people out there that are just fine with it. They understand it, and they understand the reasoning behind it, and they're compliant, and they're doing the right thing. And we're hearing from a small group, and I'm not
Well,
there.
I'd like to make it clear tonight, Joanne, I'm not voting this way. I've been thinking about this for weeks. I'm not thinking about just the people who spoke tonight. I'm thinking about what I've seen in town and what I think would actually get us what we're trying to do, which is to get most people, 100% if possible, to be vaccinated and to be careful when they're out and about. I think this approach that we're doing, we have to be really, really careful, because as the weeks and weeks go on, people are going to get more and more pushback against this, even if they weren't before.
Yeah, and I see that, and I see, we all like our personal choice. I feel like I've been on, I can very clearly see both sides, and I've been on the bubble, but I feel strongly that our numbers haven't come down enough, and that kids need the opportunity for us to protect them a little bit longer.
No, Stephanie, I agree. So what about this for a proposal? I'm just throwing this out. It's not a motion. But what if we said somewhere around mid-December that at our next meeting, if the numbers haven't gone up, if they haven't spiked, and assuming that kids are able to get vaccinated from 5 to 11, that we will rescind the mandate?
Well, I would certainly like to see us outside of the high transmission area, which we're currently in.
I thought that's what we discussed last time, that we were going to do 3 weeks of declining data. The
but
numbers.
they have gone down. So I'm confused.
No,
we've gone up for the last 3 weeks, Sue.
Stephanie, I'm telling you right now, the numbers have gone down.
Our case numbers in Westford have gone down.
That's what I mean. Case numbers have gone down. Yes.
In our community.
I guess we'll have to get together, because when I look at the ones reported by the state.
I know, all I'm telling you though is, like, I have been on Maven. There was, there are not as many coming in. And I'm well aware of it because of the contact tracing issue. And yeah, I'm telling you, there has really been a handful, which has been, thank you, God. I mean, that's what we've been saying. And I'm not saying it's not gonna move around. I know of a couple of cases that will be hitting because there's a few school-age children that I'm aware of, but the numbers, I can tell you from watching them, no matter what you're seeing on if you were to go into Maven, Stephanie, they have come down. They have.
Well, I guess if for the next meeting, you guys can provide us with a report of a weekly Maven count that demonstrates that for the last month, that would be fabulous. It's not what shows up in the state reported data.
Right, and we don't all live and work and stay in Westford solely. If the Middlesex County transmission rate is high, I mean, I certainly work in all kinds of towns in Middlesex County. So I don't stay in Westford. So I think we need to look at a larger bubble. We're not in a bubble in Westford.
Unfortunately, yeah, I mean.
Well, that's why I'm suggesting that we have some kind of language tonight where if we're not spiking, if we're, in, I don't know what you want to say, moderate territory, or be better if it was in low territory, and the kids have had a chance to get, because I totally hear you, Stephanie, it's just because the kids can get vaccinated now, it's going to take some weeks to get them vaccinated. But if we had some language that said, at our next meeting, we expect to be able to remove the mandate if these conditions are met, I think it could go a long way to make people understand what our rationale is and that it won't be a mandate forever.
Well, it was never going to be a mandate forever. I mean, that was the whole problem with the first time, was there wasn't a date, right? And people were like, give us something to hang our hat on. You can't just leave this open-ended. And that's when I was saying the January 15th or the January 4th, that's a date. I mean, I think we should be looking at this at every meeting. But I would also like to see vaccine data. Are just because the vaccine's available, are people getting their children vaccinated? And how many are vaccinated, with one shot or possibly two by then? Like, what is our vaccination status as well? Because I agree. I mean, I think we need to protect the kids for a little, so hang on a little bit longer, make sure that they have the ability to be vaccinated, fully vaccinated, and get through the winter holidays. And then be done with it. But I'm a little leery to say that on the December meeting, we're going to vote to possibly rescind. I think we should say that we're going to relook at, everything that's going on in December and talk about it again and make a decision, but see some vaccine data.
I would say, most certainly with the hope that, either January 4th or January 15th, we can say mask mandate completely rescinded.
Right. I think we need to get through Christmas and see what happens.
I hadn't heard that England was experiencing another surge.
Yes, I read that today.
Been in a blissful bubble of not listening to enough news. So I guess, I still would put out a, what's the word? I'm blanking, I'm tired.
Request. We don't necessarily have to do anything.
Well, I would like to at least change the
2 to 4 year old.
2 to 4. Yeah, I think that would be appropriate.
Amendment, or what is it?
We can amend it. We can amend the mandate.
Amend our mandate and allow 2 to 4 year olds.
Strongly recommend.
Yeah, strongly recommend that 2 to 4 year olds wear masks.
And it's not a mandate.
Require it for 5 and up. So I'll make that motion. Is there discussion? Joanne, second. All in favor?
Aye.
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 All right, so that passes unanimously. And I think, unless there's a motion made, we'll come back to this next month with us. There's some, Joanne, your lips are
Yeah, do we currently, we don't, what did we do last meeting? We talked about having the 3 weeks of data, right?
Mhm.
But we didn't have any kind of a date, a firm milestone to make a decision by. Do we want to not do that? Or we just say we're going to look at it again next month? Or
Ray, when you look at our next
Mhm.
meeting dates, we need,
Yes.
sorry, I'm cold and I'm tired, so I'm like shivering and
December 12th is the next meeting.
December 12th, and then that week.
the 12th is a Sunday.
Oh,
13th?
13.
You don't want to come on Sunday? No, it's Monday. I'm sorry, it's the 13th.
December 13th. Okay. And then January
10th.
10th.
January 10th. So that would, well, it would be before the 15th or after the 4th if we went, with either one of the 2 January dates, or.
So, I mean, if next meeting things are looking good and they're still trending downward, then maybe we can, set an end date.
And there's no reason why we can't add in a special meeting if we feel it's necessary.
Yeah.
Mm-hmm. I mean, it is before Christmas and New Year's, the December. So we won't know how that
Right.
plays out if we do it in December, but
Right. I think we need to wait until January
Look at
to
the
really assess like what happened over the holiday season.
I agree.
So I'm not seeing any, I guess at this point we're sort of moving on from this discussion until next month, when hopefully we can have, so would either Ray or Sue, would one of you be able to bring pick it, what day do we want? A Monday date each week or a Wednesday each week? A lot of it depends.
Ray can run. I mean, Ray, you know how to run the report.
All these reports you can run out of me.
Yeah, you can get
Mhm.
yeah.
So our weekly case count for the month of, or the 3 weeks leading or 4 weeks leading up to our next meeting, can we get a Monday weekly case count, or pick a day and just have it the same?
Yeah.
From May, that we can compare that.
Yep.
Mm-hmm.
That would be helpful. Just
Not a problem.
I have to say, our testing rate in Westford is actually really low.
Yeah.
All things relative, which has its pros and
Really?
cons there too. Yeah. Relative to other towns around us, our test rate is low, other than Lowell.
That's not good.
No, it's not good, because that means there are potential cases we're unaware of.
Well, the one little issue I will tell you is that some people are using the at-home tests and not reporting it. So that has been a little bit of an issue. Yeah.
Okay. Then we will move on from COVID, and we just have new and old business.
All righty. New and old business, town and staff flu, COVID, and booster clinics. So I just wanted to let the board know that the drive-through clinics have been completed. We have inoculated a little over 1,200 residents. We average about 1,300 a year. As Sue had mentioned earlier, they had just had a clinic at the academy for some students and staff and their families.
No, that was at Stony Brook.
Oh, excuse me, Stony Brook. I apologize. Thank you. Thank you. The booster clinics, as I mentioned, we're looking for another avenue for booster clinics here in town. We did apply for the mobile booster clinic, and as of this morning, we're denied that request. So we're waiting to hear back on that. COVID clinics for kids 5 through 11 will be at the Westford Academy, and we're going to get that information out tomorrow to the schools. So as I mentioned earlier, we do have dates set for December and January.
So you said November 18th and December 9th.
Yes, thank you. I apologize. Yes, thank you. Contact tracing. So we have advertised for a additional contact tracer for our community. As of a week and a half ago, we no longer have any more contact tracers working for the health department. So we do need some help with that. So we have reached out to the town manager's office. We have put together a job description and advertisement, and we have given that to HR to start those requests to see if we can bring someone in to help us out, help Gail out while she's running these clinics. So I want to make sure you're all aware of that situation with contact tracing right now. The school nurses have been doing contact tracing during the day, and well, for the last year or so, my understanding too is they've been doing that on nights and weekends. So we've been trying to work with that to see how we can resolve that, as Sue had mentioned earlier. Public health shared excellent grants. Interviews are starting next week for the community health coordinator. We have received 7 applications that we found to be viable. So we're working with the communities Acton, Lowell, Dracut, and our BME strategies consultant who is helping us bring that process on board. That position will be remote, and they will also sit in the department. It's a full-time position, benefited, and again, all paid through the grant. Open meeting law complaint response. So in your packet, I just wanted you to see the response that town council had given back and had sent to the Attorney General's office on the behalf of the board. Again, that was not cited as a violation. So that is in your packet if you have any questions on that. It's kind of funny how everything happens right now. Microblading, I've been here 16 years. We just had our first body art license for microblading about 2 years ago. This week we have 3 new applicants. We've also had our very first tanning license issued. Again, being here this long, I've never issued a tanning license, so this has been kind of interesting. So that is coming to town. So we've been working with the new establishments to get them onboarded, educated, and inspected. So I just want to mention that when you see that in town. Healthy Lakes and Ponds Seminar. The Healthy Lakes and Ponds Seminar is going to take place on November 18th from 6:30 to 8:30 at the Navnasset Lake Country Club. And that's an event where we are bringing in several project managers, environmental engineers to speak on our lakes and ponds here in Westford. The health department sits on this collaborative as a co-chair with the conservation agent and a representative for every lake and ponds here in Westford. So that is any questions you have about algal blooms or nutrient remediation. This is an event open to the public or in person where they can certainly ask any questions and learn more about their lakes and ponds. And I think that is it, unless you have any questions for me or like I said, I'm happy to make the changes to the mandate and get you any information you need for the next meeting.
I guess I hope that those with 2 to 4-year-olds are listening, or preschool or daycares. But all right, thank you, Ray. Good work.
Thanks, Ray.
Thank you, Ray.
Sure, thank you.
Can I ask a question?
Sure.
It's not COVID. It's something other than COVID. The apartment, the house there that went into receivership.
472 Groton Road.
Yeah, is there any new update?
There is. So we are working with their town council. They sent over a new stipulation. The new owner, which is the son, wants to continue with the building to be demoed. There were some things that I felt that were missing in the stipulation, for instance, timelines. There is a leach pit out in the property that needs to be properly capped, if you will, filled and capped. So I've asked that some additional things be added to the stipulation that was sent over to their counsel. The receiver did not have any issues or disputes, felt that was perfectly reasonable. And so I am just waiting for that to come back so that I can show you that. You know, I want to make sure this doesn't go on forever. And so speaking with the receiver last week, they are, you know, happy to get rid of the home and do the demolition as quickly as possible. But again, I just want to make sure that's in writing. We have had on our end here at the health department, I've never seen so many hoarding and housing cases within the last 2 weeks in our department. It's a perfect storm right now, if you will. So I did not add that yet, like I said, because we are waiting for the final paperwork through council. As soon as I have that, I'll pass it on to you.
Okay. Thank you. It was
You're welcome.
Something not COVID.
Absolutely. Well, I never thought that we would, like, you know, the COVID, hoarding cases on weekends and nights that have come in the last couple of weeks, like I said, have been unprecedented. And you know, I never thought I'd welcome something other than COVID so much. So I understand.
Thank you.
You're welcome.
I guess we're at the end of our meeting.
Good. Yes.
Make a motion.
I'll make that motion.
Michelle makes a motion to end the meeting, to adjourn the meeting. Is there a second?
Go for it, Sue.
Yes, second, Sue.
All in favor?
Aye.
Thank you. I hope you have a great Thanksgiving.
Good night, everyone. Thank you,
Happy
guys.
Thanksgiving,
Night,
everyone.
everybody.
Thank you, everybody.
Bye, guys.